If you're gearing up for the NCLEX, you already know cardiac pharmacology is one of those topics that just makes people nervous. It feels like this huge mountain of drug names, doses, and side effects. But what if I told you the secret to crushing it isn't about memorizing at all? What if it's something totally different?
This one idea? It changes everything. Seriously, the NCLEX isn't out there trying to trick you with some obscure drug name you've never heard of. It's testing one simple thing. Can you keep your patients safe? And once you get that, it's a huge shift in how you need to study. And this is exactly why. You could memorize 100 different side effects for a single drug, but if you don't know the one thing you have to monitor, that key lab value, that crucial vital sign, you're completely missing the point of the question. You're missing the risk.
Let me be crystal clear about this. The entire exam is designed to see if you can spot a disaster before it happens. It's not about remembering the suffix of a drug. It's about you recognizing that one sign or symptom that tells you your patient is in real, immediate danger.
So let's put this whole idea into action. Right now, we're going to give you a little preview of the exam coach's method. I'm going to show you how we take this massive, overwhelming topic and turn it into a simple, repeatable safety framework you can actually use on exam day.
Does this look familiar? Yeah, we see this all the time. So many students feel like they're just drowning in all these different drug classes, trying to brute force memorize suffixes without even knowing why. They miss the labs that matter, they overlook the deadliest side effects, and they just can't connect the dots on how the drug is actually helping the heart. It's a total recipe for confusion and anxiety.
This right here is the solution. From now on, every single time you see a medication question, I want you to rephrase it in your head. How do I keep this patient safe? When you start thinking like that, I promise you, everything starts to click into place.
Okay, let's actually put this into practice. We're going to start with anticoagulants, and we're going to apply what we call the safety filter. Look at how this just cuts through all the noise. Instead of trying to remember 20 random facts, the exam coach's framework forces you to focus. For heparin, you think APTT. For warfarin, you think PT/INR. You instantly connect the drug to its lab, its reversal agent, and its number one risk, bleeding. It's simple, it's structured, and it's safe.
So you see a question like this, and that safety filter in your brain should be blaring. An INR of 4.5, whoa, that's way, way above the normal therapeutic range. So your immediate concern is a massive risk for bleeding. Your first action here is absolutely critical, and that's the kind of logic we build inside the platform.
All right, let's keep this moving and see how the system builds. Next up, cardiac glycosides like Digoxin. Now this drug is a perfect example of something that gives a huge benefit. It makes the heart contract stronger, but it comes with this razor-thin margin of safety.
And here's its safety system. 4 checks. These are non-negotiable. First, you check that apical pulse for a full minute, and if it's below 60, you hold the dose. That is a hard stop. Second, you got to know that tiny therapeutic range. Third, you watch for toxicity. The NCLEX loves asking about those visual changes, like seeing yellow halos. And finally, you know the antidote. This is your mental checklist, every single time. This is another classic NCLEX setup. The pulse is 54. The rule is crystal clear. So your action isn't just about holding the med. It's about what you do next. Who do you call? What else do you assess? That's the structured thinking we drill down on.
On to diuretics. Listen, the NCLEX doesn't care if you can name all 5 different types. What it cares about is if you understand what these drugs do to a patient's fluid and, even more importantly, to their electrolytes.
So our framework organizes them by their biggest risk. You see a loop diuretic, like furosemide? They waste potassium. Just think loop loses, so your number one risk is hypokalemia. Then you have potassium-sparing diuretics, like spironolactone. Well, the name says it all. The risk is the opposite, hyperkalemia. See? You're not just memorizing, you're connecting the drug class to its core danger.
So when a question like this pops up, your brain should immediately connect the dots. Furosemide, that's a loop diuretic. It loses potassium, which means hypokalemia. And what's a classic sign of hypokalemia? Muscle cramps. The priority lab you need to check becomes completely obvious. See how the framework just leads you straight to the right answer?
All right, next up, antihypertensives. I know this is a huge category, but we can apply a system here too. The trick is to organize them by their major red flags, the things the NCLEX loves to test. This table right here is pure high-yield thinking. For ACE inhibitors, the NCLEX red flag is that annoying, persistent dry cough, and much more dangerously, life-threatening angioedema. For beta blockers, you're watching for bradycardia and the risk of bronchospasm, which is why we're super careful with our asthma patients.
For calcium channel blockers, it's all about hypotension. And for every single one of them, the key patient teaching is safety. Change positions slowly.
This is such a common scenario. Dizziness when standing up is a classic sign of orthostatic hypotension, but the question isn't just about spotting it. It's about prioritizing your nursing action. What do you do first to keep that patient safe?
Let's talk about chest pain and anti-anginals. When it comes to nitroglycerin, the NCLEX expects you to know the procedure cold. There is absolutely no room for error here. We call it the perfusion protocol. This protocol has to be automatic for you. 1 tablet under the tongue, wait 5 minutes. Still have pain? Give a second one. Wait another 5 minutes. Still have pain? A third and final dose. Now, here's the critical part. If a patient is at home and that first dose doesn't work, they need to call 911. In the hospital, if 3 doses don't bring relief, you are escalating care immediately.
This question is a direct test of that sequence. It's not about guessing. It's about knowing the step-by-step safety protocol. What do you need to check? What do you do before you even think about giving that second dose?
And now, for the class that gives pretty much everyone nightmares, anti-arrhythmics. These drugs are incredibly powerful for fixing abnormal heart rhythms, but man, they carry a huge risk.
So, our framework simplifies this whole mess into a 4-point safety system. First, you classify its mechanism. Second, you have to know that continuous ECG monitoring is absolutely non-negotiable. Third, and this is a massive NCLEX concept, you have to recognize that the very drug meant to fix an arrhythmia can actually cause a new, deadlier one. And finally, you're always assessing for bradycardia and hypotension. Those are the red flags that the drug's effect is way too strong.
This is the ultimate safety question. The drug you gave to fix a rhythm problem might be causing a brand new one. Before you do anything else, what is the absolute first thing you must assess on that patient?
So when you look at this mind map, you start to see that these aren't just 6 random groups of drugs. There's 6 different tools that we use to manage one single interconnected system, the heart.
Let's put it all together real quick. Anticoagulants prevent clots. Glycosides strengthen the pump. Diuretics take off extra fluid. Antihypertensives lower the pressure. Anti-Anginals improve blood flow. And antiarrhythmics stabilize the rhythm. See? Each one has a very clear job.
But here it is. This is the single most important thing you need to take away from this entire explainer. Knowing the drug's job, that's just level 1. The NCLEX operates at level 2. It already assumes you know what the drug does. The real question is always about your priority nursing action, what you monitor, what you assess, what you do first to keep that patient safe.
And that is exactly what we do differently. We don't just throw lists of drug categories at you and hope you memorize them. We actively train you to see the pattern of risk that comes with each and every class. We train you to instantly know the #1 thing you need to monitor for any cardiac medication. This is all about building that instinct for exam-level safety, so when you're sitting for the test, it's just second nature.
Never forget this. When you're stuck between 2 answer choices, just ask yourself, which one of these actions provides the most immediate safety for my patient? 9 times out of 10, that is going to be your correct, high-scoring answer.
What you've seen here today is really just a glimpse of our method. The complete system, with all the drug classes, the detailed safety frameworks, and the practice questions that build this kind of critical thinking, is waiting for you inside Exam Coaches.